Good evening, everybody. Happy Wednesday. Again, I pray that all of you are safe and sound and virus-free. Great challenging questions today, and I'm looking forward to talking to you about those. Before I do, though, we had some information about testing. We are now able to get testing for you for the SARS CoV-2 virus from home. So contact us if you're my patient. Contact me, and I'll be happy to set something up for you where you could test yourself at home, and so that you're not getting exposed by coming into any office. Okay, it is a nasal swab test. It's not a nasal swab that goes all the way back. It just goes into the nostril. The instructions are quite easy, and it's going to offer a lot more people the availability of testing, like I said, right from home. Okay. What I want to emphasize today, as I've emphasized in the past, is that as a physician, as a community physician, as a physician giving information over the internet, I feel it is my responsibility, in fact it is my responsibility, to give you information that is factual, that has medical evidence to support it, that has been shown to be beneficial, that is not dangerous for you to receive. There was hope that hydroxychloroquine on its own, with azithromycin, with zinc, without zinc, would have been helpful for the treatment of COVID-19. And it appeared as if it was helpful in the beginning. That has not shown to be true. As I stated a few days ago, there were two very strong studies that showed it was not effective. However, there was a study from a country in Europe that did show in the beginning that it may have benefited patients. And in fact, there might be a physician or two in our country who stated that it was helpful for their patients. And I'm going to explain how that can be, while at the same time evidence-based or double-blind controlled studies have shown that it was not beneficial. The good news about SARS CoV-2, and in fact the good news about the disease COVID-19, is that if you are unlucky enough to have the disease, now I'm not talking about the carrier state where you have the virus in you but it's not causing disease. I'm talking about COVID-19 where you actually have the disease. The good news is that if you do get the disease, 98% of you will clear that disease. So let's take that into context in a doctor's office. In other words, let's take 100 patients that truly have tested positive, and in fact, we need to trust that that has occurred in other doctors' offices where that physician tested patients for COVID-19, or the virus that causes COVID-19, which is SARS CoV-2. They tested, and those patients, those 100, let's say 100 patients tested positive for SARS CoV-2. Let's say that doctor then gave those patients, in this situation, let's say a combination of hydroxychloroquine, zinc, and azithromycin. And then after 2 weeks, they were done with the medications. After 2 weeks, he tested those 100 patients. And let's suppose he had a 98% effectiveness, a 98% cure rate. Well, if we took away those medicines, tested 100 people, this time let's give them green M&Ms. Okay? 100 people tested positive for COVID-19. We gave everybody green M&Ms to take. 2 weeks later, we tested for COVID-19 again, SARS CoV-2. And they all tested, 98% tested negative. Well, that office would report that green M&Ms were 98% effective at treating SARS CoV-2. Let's use quinine water. How about that? 100 patients test positive, COVID-2. We give them quinine water, we give them tonic water, right? They drink the tonic water every day. Then 2 weeks later we test. 98% got better. Tonic water, 98% efficacy rate, 98% cure rate. As I've said to you before, you're smarter than what you're hearing in the media. You're smarter than what you're hearing on social media. You just have to separate, out the BS. There are multiple medications being tested. We have not had any positive outcomes enough to where we as a medical community can say this is a cure for SARS CoV-2 or COVID-19. You will continue to hear from people, and maybe sometimes physicians, who believe they have a cure for this. I want you to stay smart about that. I want you to filter that through what we're talking about now. I want you to filter it through the green M&M theory. No, green M&Ms do not treat, cure, or nor are recommended for COVID-19. 98% of people with COVID-19 will get better. And that's great news. And it's phenomenal news. Any doctor, clinic, chiropractor, therapist who wants to try to make you believe that he can treat COVID-19 patients with a medicine, supplement, vitamin, by mouth, by IV, and get a high cure rate, is inaccurate. There's no agenda here except to educate you. So you're not taken advantage of. You know, it's human. It's human nature. We want to believe that there's a cure for this. And we want to believe it's as simple as IV vitamin C. We want to believe what our politicians have told us, even very high-ranking politicians who said, we have a medicine called hydroxychloroquine and it could treat this disease, but we've proven that it doesn't. It doesn't work. I want it to work. It's so easy. It's there. It's 60 cents a pill. It's cheap. It doesn't work. The two studies that came out last week showed it just doesn't work. It's not there. Please don't buy into this quinine thing either, or the IV vitamin C, or the other dozens, if not hundreds of things that are going to come out. I will give you information, and I promise you, as a physician, as a brother, as someone who is nervous about this virus, I promise you that the information that I'm going to give you every single day that I do this is going to be the most accurate information that is available. It is not going to be any guess. And if I ever give my opinion that is not based on empirical evidence, I will tell you up front. I can't prove that you doing aerobic exercise will cure COVID-19. But it is my opinion that you doing aerobic exercise can help your immune system. My opinion. For some reason, there are people in this world that want to prove to you, that want you to follow them on these off-label treatments that could be potentially deadly if you follow them. The moment that a medication becomes available that has been proven to be effective to treat COVID-19, and that it's safe, I will let you know. I have no agenda but to help you. Once again, it is my honor and privilege to do this with you, to do this for you every evening. I will continue to do it. And I will continue to answer questions. And I will continue to shed light on issues that are confusing. Keep it simple. It's a respiratory virus. Cover your face. You don't spread the respiratory virus. People's lives are saved. Have a good night, everybody. We'll see you tomorrow.